Thank you, Hele. So hopefully everybody's nice and relaxed. And the point of that little exercise hypnosis was just to kind of give you a little bit of we've all now felt what hypnotherapy is like. This is just a little bit of an example on the medical side. So as I've said, I've worked in the medical field for 22 years, so I can't even tell you how many times we've prepared a patient for surgery. They've done their pre-ops, they've done their, they have their medications, they have everything set up, and then the information is there, but their mind is not ready. Their body is not ready. They're completely, nervous. They're completely not prepared for the surgery. So what is medical hypnosis? It's essentially, guided state of focused attention and concentration, just like any hypnosis. So the benefit of medical hypnosis is that there's medical hypnosis before surgery. There's medical hypnosis even during a procedure, such as local anesthesia if you're doing a dental procedure, if you're doing an IV sedation procedure, which is where some people call it a conscious sedation. It's where you have a little bit of medicine by vein, but you're awake, you're fully awake. So you can imagine how a doctor would need your cooperation for that. So in these instances, hypnotherapy is an invaluable tool. I can't even tell you how many nights I've had somebody, and since I started doing this, since I've incorporated hypnotherapy into the medical side of what I was doing, there were even subliminally, when I would give somebody some breathing exercises, it would start with breathing. It would start with, because everything with a human being starts with that anticipatory anxiety. It starts with that, feeling like you're not in control, feeling like you don't know what's going to happen, and then your subconscious mind, which is the programming and all of those fears that are sitting underneath, are hijacking your better sense, your logic, your reasoning, your willpower. So before the surgery, reduces anxiety, it improves your sleep. So allows you to rest, because that completely hijacks your well-being as well. Boosts your immune system, activates your internal coping resources. So it basically primes your subconscious. It primes your subconscious to do what it needs to do, which is, step aside so your body can do the healing. After the surgery, it reduces post-op pain. So we live in a country, in a state, in a world where narcotics are a huge issue for a lot of people. So this definitely helps with pre-op and post-op pain management. It decreases inflammation, as I've mentioned, and encourages mobilization and physical therapy. So, once it is okay for somebody to start getting back into physical activity, it kind of gives you that little nudge, that little push to start getting back into it, because we get lazy, we start fearing moving around, but hypnotherapy, kind of can give you that little bit of push if that's what you need. It helps mobilize your moods. And not only for the patient, but there's also a lot of benefits for the medical staff, for the medical team. There's so many nights that I remember coming into the office and the doctor is just completely exhausted because he's been getting calls all night long after a surgery. Now, if there's an issue, obviously the doctor needs to hear about it, but most of the times it was completely nerve related, things that a patient could have used an anchor for, things that a patient could have used some breath work for, all of these things. So for doctors, obviously it's more cooperative patients, it's smoother recovery, lower staff burnout, because if the staff doesn't have to continually answer questions, continually go over the same thing over and over and over, you don't have your staff, your nurses and your medical assistants and everybody there getting completely burnt out. There's so many studies, and I actually, I don't have them memorized, but I can have them for Hele to have available. But I mean, just to read off a couple of studies for you. Kaiser Permanente in 2019, 90 patients were undergoing surgery, and those receiving just one hypnotherapy session before surgery had 23% less pain, needed 34% less medication. Stanford University hypnosis reduces time in surgery rooms, patients and patient movements. So it saves hospitals money. It saves, improving outcomes. And then patients with chronic anxiety before a dental surgery. So that was one of my clients. So I had a client who was supposed to be having a dental procedure, bone grafting surgery, completely terrified. We ended up doing, we had two sessions before, and then so she ended up doing the surgery completely awake. It's a surgery that they just numb the area. She was completely awake, did beautifully, healed beautifully, and she actually went in, and it was almost like she said she knew she was going to do well before even going in, which is an amazing thing for a person to feel like, like you already won before you even going in. So that was amazing. How hypnotherapy supports the medical team, obviously, is I've worked with some psychiatrists, which is, I've had a couple of psychotherapists refer patients to me. I've had, and this is not only for on the medical side, but it's also, in other ways. You can have a physician sending you a client who's just nervous about, taking medications, nervous about, and just the regular anesthetic, or can't swallow pills, or anticipatory anxiety about, a possible blood draw, somebody who's afraid of needles. There's so many different situations where hypnotherapy can prep you, and really where we can collaborate with medical professionals, with psychotherapists, with, with a lot of different sides of the medical teams. So just kind of to recap, what I've been saying, hypnotherapy is one of these things that not only does it reduce anxiety, which is, we all know that it's one of these things where you can use your own body's rhythm, use your own body's resources to reduce the anxiety, to reduce pain, reduce inflammation. But what it does is it empowers the patient. It empowers you to feel like you're, it shifts that healing space to makes you feel like instead of sterile, it's sacred. Instead of, it gives you that role, that active role in your recovery. It allows for you to feel like you're not just, like I mentioned, going in and you're just giving yourself completely to a medical team and are out of touch with what happens, how it happens. And, believe it or not, we really do have a lot more control over our bodies, over our healing, over our hormones, over so many things, So that's kind of my background and my how I brought hypnotherapy and my 22 years together. And so, JoyMind is an amazing platform for me because it gives me this opportunity to really present, and combine these 22 years. So I would love, and Hile can kind of jump in here, but I would love to see, people for this kind of thing. I would love to have, if there's any one of you that is either experiencing any kind of or is facing any kind of a medical procedure, or if you know somebody who's, and not just a medical procedure, but also any kind of a chronic medical condition, such as cancer. So, that's a whole other thing. And I can actually do another talk just on dealing with, chronic illnesses like cancer. But this kind of falls into that as well, because it is from the, on the medical side. So yeah, that's kind of, that sums it all up in short.
Yeah.